Welcome to the Living Medicine podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hi there, I am Dr. Sandy Newis, and I am the host of Living Medicine, a podcast where I interview interesting and influential people in the psychedelic-assisted psychotherapy field and adjacent areas. And this show is hosted by Living Medicine Institute, where I am CEO and the co-founder, and we provide training content and resources for therapists and medical professionals who are interested in getting into psychedelic-assisted psychotherapy. And I am excited today to be with Chad Franzen, and he has interviewed thousands of people, mostly entrepreneurs, business people, people who are involved in kind of developing successful businesses in new and interesting ways. And we are going to flip the script, and today he is actually going to interview me. So, Chad, thank you so much for being here. I really appreciate it.
Hey, thanks so much. It's always great to talk to you, Dr. Sandy. Thanks so much for having me. Hey, I'm kind of looking forward to talking about kind of some of the latest developments in in your practice and in psychotherapy and things like that. So let's kind of get into it.
All right.
I know that there was a executive order that people are excited about regarding psychedelic research, and it kind of highlights fewer restrictions potentially on therapeutic use. And it was signed a few weeks ago. What does that mean for mental health practitioners?
Right. I mean, that's the big question. So, if for anybody who's interested in a more thorough exploration of that, I, refer you to the interview that I did with Gina Giorgio a couple of weeks ago. She is the head of the Students for Sensible Drug Policy and is heavily involved in the regulatory process. So there we go over kind of all the core ins and outs of that. But, people are regularly like, what does this mean for me? So, does this mean like suddenly like 5 minutes from now, they're going to like open it wide open and then I need to be like rushing to do this? Or, what are the implications for this? And the correct answer is nobody really knows. And what that means for like the actual individual practitioner. What it does mean is that something is going to happen. Something is happening. So monies have already been released for research. There's been training grants that have been released, mostly kind of in the university arena, and something is going to happen. And so the things for people to be tracking are, one, what is happening in your state? So it's going to go to the states likely. It's unlikely that there's going to be some federal mandate that all the states have to follow. So pay attention to your states. If there's any way for you to get involved in some kind of like psychedelic policy coalition or something like that, highly recommend that, because then you'll be on the cutting edge of that. And are you going to need training? Yes, you most certainly are going to need training. What is likely to roll out first is some version of psilocybin, whether it be some kind of offshoot of psilocybin itself. MDMA, many of us were excited about that. That seems to be kind of lower down because there's kind of some, press to a different type of research. And what it really is watch the things that have promising and emerging status, because those are the things that are being fast-tracked. There is no mandate about training currently. We don't know what that's going to look like, but it's probably a useful idea to get some of that. If that you're already interested in it, now's a good time. And also track the right to try piece, because right to try is actually the most immediate access. And what that means is that if somebody has a life-threatening illness, of which PTSD counts and so does treatment-resistant depression, they can advocate for themselves to be able to try research compounds that show promising status. And again, nobody quite knows who the gatekeepers of that is going to be, but it's going to be the prescribers. So there's going to be some version of a prescriber and a therapist sort of come together to form some sort of team where they'd be able to provide that. And that, again, is not happening instantaneously, but those are the things that I would be tracking about that. So and again, always keeping in mind that ketamine isn't illegal. It's never been illegal. And so, it doesn't really, what does that have to do with ketamine? It has to do with increased publicity. It has to do with how does this fit into a broader landscape where other psychedelics might be more accessible. And, it continues to highlight how important it is to hone our skills at working with this really powerful medicine. And it's also a great way to prepare yourself for other medicines too. in which I personally hope ketamine continues, like that
Hmm.
it doesn't sort of diminish because it's really powerful and it fits really well into a existing practice. So,
Yeah, we'll talk about a little bit more about ketamine coming up here. In terms of training, what does it look like? What does this look like then for training programs?
um, well, once again, nobody really knows.
Hmm.
Like the people that are obviously like ahead of the curve, if they were going to talk about that, would be Oregon and Colorado. And so both states, but certainly Colorado for sure. I can't speak definitively about Oregon. Opened it up that people from outside of the state can come in, get the training, and then they can and do the practicum. So there is a pretty rigorous training and practicum required specifically for psilocybin, and that then you can actually practice. So you could go into the state, you could, work with the center, those kinds of things. What I hope will happen is that over time, that people can kind of find different modules that they do at different types of training programs. And for example, you might want to get history of the field one place, or foundations, or the science in another place, and then clinical skills applications and things like that. You might want to get those in another place. So there will always be medicine specific trainings, but my hope is that there will also be foundational pieces that will go across all of the different medicines, including ketamine, so that you can get that training in a variety of different ways that kind of meet your individual needs.
What are the implications for therapists versus medical practitioners?
Well, the medical people, I mean, in my world, I would love to always see a prescriber therapist team.
Hmm.
And I personally believe that this work should be done in community and that it's best done as a team in general. That doesn't necessarily mean two people in the room, but somebody that you can consult with, somebody that you can collaborate with. Like this is a brand new emerging field. And so it's really important that we all continue to grow, that we continue to learn, that we continue to work with other people, that sparks our creativity, that sparks our interest, and that we do that in community, both so that we can grow and continue to collaboratively develop it, but also kind of create checks and balances so people don't get carried away, that we are aware of right use of power and all of those different things. So the prescribers are always going to hold a a piece that the therapists are never going to have, that
Hmm.
they can write the script, that they have access to the actual medicine, and so ultimately they're the ones that have the highest level of risk. So therapists always need to respect that work with the prescriber, that ultimately they're holding the highest level of risk. And some prescribers are going to be very, very well versed in all of the different medicines and how to work with them, and some are not. So just kind of keeping that in mind. But I do think that the power will go to the prescribers first, and a therapist can't work without a prescriber. So, so therapists, like, that's kind of another, start developing relationships with prescribers. How do you find them? Get on forums, talk to them, kind of Google them, just sort of see if you can get in the mix, in some of the conversations and some of the dialogues is a really great way to do that. Um, and also, continue to get your own training, continue to be in the mix. Like if you are really interested in this field, you'll find that there's a chunk of us that are like oddly mission driven. Like we're just like all about this.
Hmm.
And, so if it calls to you, it's endlessly fascinating. And so it's fun to be involved in it. Like it's interesting, it's fun, it's super multimodal, and it's very dynamic in lots of ways.
So you talked about, you hope ketamine remains a viable option. Why is that in question?
I mean, I get asked all the time. So I do all of the calls for Living Medicine Institute, people who
Hmm.
are interested. I schedule half-hour interview and we talk about the state of the field. And so all the time people ask me like, how does ketamine compare to other medicines? And, when like, will this prepare me to work with other medicines? And when other medicines become legal and viable, what will happen with ketamine? And people ask me that like, I mean, I have that conversation multiple times a week.
Mm.
And the reality is that I've been working with ketamine full time since 2019. It's powerful, it's incredibly clinically useful, and it fits in to a regular clinical practice. Like I schedule 2-hour sessions So, if you work with nasal or you work at an IV clinic or an, intramuscular clinic with a medical team, you can schedule 2-hour sessions very reliably. And in the process of that, no one is rushed. Clients are doing really great work. They have all of their needs met. And it just fits. You can schedule it, you can plan around it, and you can fit it into your schedule. Whereas the other medicines require an entire day, and some of them, require people to get off their
Mhm.
medications. That's psilocybin. So there's a lot of preparation that goes into it. Whereas ketamine doesn't have any of that. But it's not. So the logistics of it are very straightforward. It's easier to fit into a clinical practice than any of them, but it's also exceptionally powerful work, and it happens in kind of sound bites. Like, we do preparation, we do medicine session, we do integration. That would be a sound bite. And then we, put those together to form an entire song. So
Mhm.
it's not about this one medicine session. It's about the whole entire process, and then often doing medicine sessions in series. Whereas in other medicines where you go in longer, you still might do more than one, but it has kind of a different, maybe you do two, maybe you do three, but it's different than the way that you do ketamine. Like I do ketamine like weekly, and
Mhm.
6 sessions in a row over 6 weeks commonly. So I don't do less than three. Sometimes I do up to eight. And then we schedule kind of booster and maintenance sessions afterwards. And that can be very, very individualized based on client need. And we don't know with other medicines, like, I don't know if we'll be able to step outside of the research parameters. We just don't know. Like, if somebody's going to be able to do more than two, or do we need to do more than two? Because we're also looking at a 6-hour session. Like, so there's just a lot of variables that we don't know. And we've been working with ketamine a really long time. I've been at it, like I said, since 2019. It has a predictable flow that I can absolutely individualize, but once you learn the frame, it's you can stay within the frame pretty easily is the wrong word, but it kind of has some, like, you can see the road, and
Mhm.
you can learn how to work with the particular road.
So I think I've asked you this before, and maybe you've told me this before, but I'm not sure. You don't use ketamine in every session that you do. Like some you go without anything like that, right?
No, yeah. I mean, I have an entire practice that's built largely around clients that are doing CAP. And what that looks like is, if I have a new client, I'll do 3 to 5 preparation sessions, never less than three.
Mhm.
And then we'll do a medicine session, and then we'll do an integration session afterward. So it's always preparation, medicine, integration.
Mhm.
And I won't do less than three in close proximity. Close proximity is generally a week apart. And personally, I think that, that 4 to 8 is really the sweet spot. And that's probably also because I work with developmental trauma. So people have a lot of things that are deeply embedded in their nervous system. Other people work differently, but that to me is what I find to be the most effective for working with clients that have really long-standing, deeply entrenched
Mhm.
issues.
So what would be the difference? I mean, obviously, there's probably a huge difference between not having ketamine as part of it and having ketamine as part of it. What would be, some of the benefits? Why are you such a big fan of having ketamine as a part of it?
Hmm. So during the time that someone is with the medicine. So first of all, let me say, like, in a perfect world, I would wave the magic wand and I would get everybody to adopt a different word than preparation, because it puts too much of the emphasis on the medicine. Like, the
Mhm.
medicine is one part of the equation. Like, in those 3 to 5 preparation sessions, like, we're not just getting ready to do the medicine. Like, I mean, I'm doing, oh, look, here's my cat. I'm doing an, hi, kitty. I'm doing an extensive developmental history. I am exploring what their goals are. I'm doing everything I can to figure out what the underlying issues that are driving the symptoms that they're presenting with and the issues that they're presenting with. I'm teaching them skills to connect to their body. I'm teaching them skills to connect to to connect to themselves, the world, and others. And I do that through the body and connecting with that and understanding the overall state of their nervous system. And so doing all of that is what preparation is about. And that gives me the framework when I'm doing the ketamine work to be able to, that gives me the framework when I'm in the medicine and in the integration to build the bridge with the preparation. So it's that there's a very specific kind of methodology that I use. And that methodology I teach others, but it also builds on what I came in with before. So that is my clinical style, which is, grounded in psychodynamic psychotherapy. It's got a smattering of CBT, a lot of, deep level somatic work, and kind of a brain-based approach to trauma and resilience, and more with some positive psychology, like moving into positive affect tolerance and the ability to feel safe, feeling good. So all of that predates the ketamine, and that informs, my whole entire clinical process while using the medicine. And then the medicine itself is a tool. So during the actual medicine session, their defenses are down. So always keeping in mind, as part of that preparation, is that the client feels seen, understood, and like I get them.
Hmm.
And so it's not just like a Q&A, tell me about everything about your life. It's we are developing a relationship. And that is a really core element of the way that I work and what we teach in Living Medicine Institute, which is that this is a relational intervention. So a person has to feel very safe with me in the way that they do the work, in the way that they feel held and supported by not only me, but the overall container in which they enter into. So then in the medicine session, in that I'm connecting to them to their body. So I do some mindfulness practice and connecting them, connecting their body to the chair so that we have a place to go back to. And then we're simply using deepening prompts. What are you noticing? What's happening? Let's be curious about that. And I'm tracking everything that's coming up that they're narrating. And sometimes they don't talk, but much of the time they do. And I'm writing it down. And then my role is to track that and link that into their developmental history, their relational history, kind of their overall, being, as well as their treatment goals. So I'm watching for those things. So I'm noticing, I'm prompting, then I say, oh, that's interesting. Let's be curious about that. Let's just pause and we notice. So what's happening for them is that the ketamine is opening up. It's often called, the inner healing intelligence or inner directed approach, where there's a belief that a client's higher self or that of their wise self, we can call it their subconscious mind. If we prompt it correctly or well in preparation, that things are going to emerge that is in their best interest, that is in alignment with their healing. And it's not magic. Like, it's not like, oh, we just prompt our higher self and all this wisdom pours out. No, there's very much a skill set to making that happen. That's just the language that we use. It's really a
Hmm.
form of depth psychology. And in my point of view, it's a very psychodynamically oriented intervention that has, somatic and relational elements. And so we do that. So the clients, then their defensive holds are loosened. My current personal therapist calls them their adaptive strategies are not as rigidly held. Different parts might emerge, to kind of use IFS language. And we can track that and we can work with that. Sometimes the client can have more of an observer self, so they can see their own issues differently than they might otherwise. And they're not like engulfed by them, they're next to them. They can see them, they can witness them, they can come to understand their own patterns. And sometimes that's specific content that comes out about their past or about their relational history. Sometimes that might be traumatic material. But sometimes, and this is one of the kind of sort of unique pieces I think that we teach at Living Medicine Institute, there is a piece about what's called parallel process and experiential education. So the way in which the client enters into the experience at every step of the way they engage with you in preparation, the way that they enter the experience, the way they drop into the medicine, actually is a mirror to use that experience for them to learn about themselves. And you, as the therapist, is also holding that and looking into that same mirror. And that then illuminates some of their underlying personality patterns. And those things are what are driving the symptoms. So that level of complexity is really important to understand. It's not just what comes up for a client in the session. There's many layers and levels to it.
In terms of clinical work, what else are you kind of particularly excited about these days?
Well, I mean, one of the things that's always interesting is I tell people I've been doing this since 2019, and the way I started in 2019 is not the way that I'm doing it now. And the way that I'll be doing it 2 years from now is also, it'll have some similarities, but it's different than what I'm doing now. And you know, one, that's kind of the same as being a therapist. Like you're always evolving and you're always trying to shift and grow and develop new skills, but it's also a function of this being a really new dynamic field. And there's a tremendous amount that's happening in the non-ordinary state that we just don't know. These like mystical elements and transpersonal elements, and there's, indigenous type wisdom, ancient wisdom that emerges. And there's a lot that is very unique to each individual client. And there's a lot that we don't know. So the more I do this, the more I'm influenced by that. Um, but one of the things I've mentioned before in kind of previous talks is the importance really of not only moving towards the bad. Like there's a prevailing view in the psychedelic world about like go towards the fear. Don't be afraid of the fear. Don't be afraid of the darkness. Go towards it. And I am actually an advocate of choice. So you could or you couldn't, right? If you're
Hmm.
just fearful to do it, well, is it always the right thing to do to override our own fears? I'm not so sure. That's actually kind of one of the core elements of trauma-informed care is choice. So I might more advocate for choice. Maybe you do, maybe you don't. And that in and of itself becomes the work. It's not all about just like diving into the pit and swimming around in there. Sometimes it is. Um, but also just, again, this piece about trauma and chronic stress rob us of our ability to feel good. And they also rob us of the ability to feel safe feeling good because we are in a constant state of hypervigilance or constant alertness for the, shoe to drop or the next bad thing to happen or for someone to hurt us. And our nervous system does that. And that's not Chad doing it or Sandy doing it. That's our brain. Our brain is in charge. And so if we're consistently in that state, it becomes very, very difficult to feel safe when things are okay and just to be able to settle into well-being, not even happiness, just a general sense of okayness or a general sense of well-being. So I'm also tracking for that in sessions when people talk about something that feels good or looks good or seems to bring them a smile, then I'll like bring them back to their body. So to deepen into that in a very somatic way, can they really notice and be with that sensation? And then I'm watching really closely what happens. And I might say, and you might notice areas of holding, right? Let's notice that. Maybe we want to hang out with the areas where that kind of well being or ease meets the holding and be curious about that. And then what I'm tracking is how is that like things that are going on in their life? And I might find a way to build that bridge. So, really working with those different nuances in that. Um, I combine that with psychoeducation about the brain and the body and the nervous system and why we do that beforehand so that they're more bought into it. It's important for clients, especially those with trauma, to understand the why about why we want to connect to the body, because for so many people it doesn't come naturally, um, and especially in the medicine. If that's the first time I'm introducing them, like, okay, what's happening in your body? They're just going to be like, what? So that it's very important to practice that beforehand and help them feel safe with that. So I'm really tracking that. And more and more with that and just noticing that I'm very interested in how the therapist's own nervous system interacts with the clients. Like I know that when I'm really deeply grounded and centered, I have better sessions with my clients. I just do. And that we have a responsibility for that. So I'm super intrigued and I'm tracking that. And effective integration. So what does that look like? Do we really know how to do that? Like, are we doing it well? Could we be doing it better? Like, I would love to see people starting to put their heads together to really take a look at what effective integration really looks like. The pieces about working in series, I'm really intrigued by that. Like, what happens when we do not only, like I said, I never do one medicine session, but a lot of people do. And what is gained and what is lost by one versus a series. And then, scientifically, like how many and how do we individualize that? Relational dynamics, like what's going on in the relationship with the client and me, what's going on in the relationship with the client and themselves. So I'm always tracking what's happening with relationships with self world and others as me. But I would also say, within the therapeutic relationship and really dialing into how that shows up during the medicine session and then what that shows the client or what their relationship with the medicine and themselves and the medicine and me in the medicine, how that parallels other medicine sessions. For example, I was working with someone today who was really deeply into their process. And as they came out, they sort of, kind of became more aware of me. And then their whole demeanor changed. And they kind of like slipped into a more defensive posturing that I know it is very familiar, but the change was notable. So tracking that and how is that and why is that? And then how does that show up for them in other relationships? Um, and just generally the use of the experience, not just what they realize. Like that we have an overemphasis, in my opinion, on insight. Like, oh, I get it. This is a different perspective on my childhood. That is only one part of the equation. So we want to
Mhm.
have them have a different experience of themselves, a different experience of being in the world. And if that means it's restful and relaxing and it feels good, then how does that become clinically relevant? So that's kind of our job, is to help that be meaningful and important.
We talked
So
about,
I guess I'm excited about a lot.
oh yeah, hey, that's it's good to be excited. Hey, so we talked about the the likely need for training, given the recent executive order on that
Mhm.
opened up psychedelic research and the training that might be necessary for mental health practitioners. What would you say that those people should realistically expect from that type of training? Emotionally, professionally, personally.
I mean, I think that you want to find someplace that is a really good fit.
Hmm.
I think fit for you. So that means talk to somebody about it. Like, what are you going to get out of it? Get a clear sense about what you're going to get out of the training. I definitely recommend working at training programs with who the faculty on the training programs are experienced at doing the work and are still currently doing the work. At least even if it's a little bit, because running a training program could, be a big business and it can take a lot out of you, but it's also important that people stay fresh and are continuing to do the work. I highly recommend taking a training program that has experiential sessions. So certainly with ketamine and other medicines as well. I very strongly believe that.
Why is that important?
It's it's just it's a non-ordinary state, and it's very, very difficult to understand unless you've done it. And I
Mm.
highly recommend that you do more than one, because with each client, you can do the same, if with ketamine, you can do the same dose in the same clinic or the same office 3 days apart with the same therapist, and everything can be they can eat the same food on the day, and the session's going to be different. So to be able to understand that yourself, that that different sessions can be different, I
Mhm.
highly recommend it. And in the process, you end up doing some of your own work, and that is something that we've had many guests on the podcast talk about, the importance of clinicians really doing their own work to understand, you know the term shadow self is kind of common in lay people, but like, what comes up for you? Where are your vulnerabilities? Where are your sensitivities? Because that's going to play itself out with clients. But it's also just important to be aware of that, to understand that we're all human and that we're all doing our own kind of, you can call it healing work, you can call it evolving humanhood work, but mostly so that you have that self-reflective lens and you're aware of what you're bringing to the table. But in more practical terms, just understanding the rhythm and the arc of medicine and where it can take people and how it can take people, and not just sitting with people who are on the medicine, but having your own experience with it, I think is of critical importance. And
So,
clients ask me all the time if I've done my own work with ketamine, and the answer is definitively yes. I
mm.
do use it. I've used it for my own mental health. I've used it for my own training purposes, and I've gotten a lot out of it.
So I'm guessing these trainings probably include, just regular clinical education, community building, and then also the experiential learning that you talked about. How is that all kind of balanced, maybe in a training session?
Mhm. Yeah. Well, every training program is going to do that differently. Some of them are going to just be foundations and content. Some of those you can probably get different sort of modules online. Like there are some of the things that you can just learn, like, the neuroscience of it and the science pieces of it and the history and the foundations of the field and the different routes of administration. Like just having a working knowledge of some of those foundational pieces, I think is something that, you can probably get some of that on YouTube and, different ways or, but the community building piece is really, really important because I, one of my teachers long ago, I worked with Malidoma Somé, and he would always say, this work needs to be done in a village. This work needs to be done in community. And I believe the same thing with psychedelic assisted psychotherapy, that there's so many kind of mysterious elements and so many moving parts that it's important that we develop a network of people who can support us, challenge us to learn and grow, and that we have a professional home. So we have a place, kind of a landing place where we can continue, to do the work. Because, one of my favorite teachers, colleagues and mentors is Dr. Ron Siegel. And I was just with him not that long ago, and he says, we're all just confused mammals muddling our way along, or some version of that. And, having a place where you can be a confused mammal muddling your way around along, and that you don't have to be Dr. Anybody, that you can be somebody who's like muddling along and doing the very best that you can at any given moment is really, really important because there's much to be learned. And there, even, I mean, I have a degree of expertise. I've been at this a long time, but I would never profess to suggest that I know everything,
Hmm.
and so kind of having that community is critical. And that
Hmm.
might be in the community that you do medicine with, but certainly that you learn with. And then the educational piece is not just the foundations, but how do you actually do the work? Like if you're working with ketamine, like how do you actually do a ketamine session? What is effective preparation? How do you do it? How do you do the medicine? How do you do integration? How do you do those things as an overall package? And then not only that, but how does that build on the foundation that you already brought to the table? Like, in my opinion, the people who do this work best are people who are more experienced clinicians who already have an established kind of style and a foundation. That doesn't mean people who are new to the field can't do this, but be a therapist first, be a clinician first, and then later in the psychedelic piece. So it's far better to do it that way than it is to flip it around, in my opinion, or at least be mindful of that. So all of that requires human connection.
Hmm.
So it requires being with experienced providers. It requires being in a cohort with people that you can talk with and that you can connect to, a network that you can develop, and, really a place that you can fine tune the nuances of this work, because there's a lot to all the different ways in which we apply this.
So, for a clinician who might be a little bit nervous, I always feel like I'm muddling along, but everybody else has everything figured out. So, if a
Right.
if a clinician is more like me and they feel like they're muddling along, but everybody else has it all figured out, what tends to surprise them most in these types of trainings once they arrive?
I think that, Living Medicine Institute is all about experience with the medicine, kind of small cohorts, do the medicine with yourself, like do the medicine with yourself, like have experience with the medicine, work with small cohorts, kind of individualized attention and developing of community, and also like really good solid clinical skills. And we have a fair amount of people that come to other training programs that do more foundational pieces that still feel as though they don't really know how to do the work. And so that's the first surprise, is like, one, it's not as hard as you think. Two, it's a lot harder than you think. I don't know how else to say that. It's like, because the real skill set is actually the synergy of the medicine with what you bring already to the table. And so kind of fine tuning that, the people I think are often surprised at how much once they get their own confidence, what I call it the confidence competence continuum. Like once they get confidence in their own skills and a degree of competence, then what really surprises them is how they're actually using so much of what they came in with before.
Hmm.
Um, the other piece that really surprises people is how powerful the medicine is.
Mm.
I mean, so, you know, you can do ketamine in a clinic, you can do ketamine recreationally, but done in a context, whether that be group or individual, where you are held and cared for and supported, and therefore you go deeply within yourself to do your own work, and it is witnessed and held and guided by somebody else, is a whole different thing. like I call it meat and fruit. Like it's like what you can eat them both, but they are not the same. And so having some semblance of that in a training program, whether that be you are paired with somebody or whether you have an opportunity to process through your own medicine experiences, like at Living Medicine Institute, we have a video series. And then we prompt people with different prompts from the video series, and then they do their own medicine work. And then they, having watched the video, listening to the prompts, and they write up some elements of their medicine experience and post it for homework. So we get to read about other people's experiences too. And so, really understanding how each one of these things dramatically influences your own experience while doing your personal work at the same time is deeply impactful.
Mm.
So, it's not just, and I think a lot of the good training programs are like that. So, that's why another reason why the experiential is so important. Like you're doing at least an element of your own work and using that as a learning tool. So you come out different. Like you have an impactful experience. Like we have our level 1 clinical intensive coming up, and then that one, you do 7 medicine sessions throughout. If you've gone to retreat, then you do 5. And so you're going to have a personal experience, and it's held within the group container. We have one-on-one time available more if you need it. So you're not doing your own therapy. You do that outside with your own therapist, but you are having your own experience, and that does inform your learning. So I think that's really another piece that surprises people is how much of a personally impactful experience it is. And that goes for our level 1 as well as our retreats. And I'm certain other training programs have that in their experiential retreats as well, that these are just powerful experiences with a group held in a safe container by experienced providers. And that is very powerful and very memorable. So that's really one of the best parts of this work is that you're doing your own personal work at the time. And it's, it's a tax write-off, but no, but but it actually makes you a better professional in the doing of it. And there's not that many places that you can really say that.
Mm-hmm.
So that synergy of the personal and professional, I think, is probably the most surprising piece of all.
How is a philosophy of trauma-informed care kind of woven throughout a good training session or good training
I
experience?
love that. So I come from a background in wilderness adventure therapy, therapeutic outdoor therapeutic work, nature connection work, and there's been a lot of emphasis on trauma-informed care there for a long time because it's very, very similar. People, I've talked about it this a bunch, but people don't realize, that is a multimodal therapeutic adventure with a multidisciplinary team that takes place in a, non-ordinary context. We could make the argument that being kind of outdoors and in nature for therapy is its own non-ordinary state. And it takes people out of their comfort zone. It puts them into relationship with others in new ways. It puts them in relationship to experiences, and it's got a high perception of risk. So people are often nervous and fearful. And all of that is a direct parallel to psychedelics. And embedded in that is also the opportunity to really abuse power. So we can traumatize people in those situations, much more. You can probably traumatize somebody in, individual talk therapy, but that's all with words. This is, much more powerful. It's with experience. It's with trust. You're putting your trust in other people, the facilitators. Oftentimes it's a group experience. So you might be putting your trust in the group. And it's of critical importance that people really be aware of what trauma-informed care is. And at a very basic level, that means that we attend to safety at every single step of the way. And while that sounds inherently obvious, like duh, right? But like putting somebody, rushing somebody into a clinic, setting them up with a chair with somebody who's like chatting with somebody else on the side, while they're putting in an IV and, there's noises all around and the person isn't adequately settled and they don't really know anybody, like that can be super traumatic. So we're not just talking physical safety, we're talking emotional safety, we're talking relational safety. So that's a big piece of that. Cross-cultural competency is really critical. So understanding, pieces of person's cultural background that are informing their experience. We're going to be doing more and more of that with Living Medicine Institute with Dr. Milena Vinacore, who's joined our teaching faculty. She's going to bring that piece. And it's really important to me that we continue to do that work. And choice is a really core element. So people having choice, that's that, do you want to go towards the fear or do you want to go towards the well-being or do you want to hang out in the choice? That's what choice is. So that people feel as though they have a choice and that they can back out at any given time, that there's a strong awareness of ethics and kind of ethical pieces. And I would put right use of power in there, and that our competencies as we develop as a field really embed these core things. And one more piece I want to say about that is trauma informed care is not processing the trauma. That's different. It sets the stage for effectively doing trauma work. But trauma informed care is really kind of core tenets that any program, clinic, practitioner can embed into what they do.
So it sounds like one of these training sessions or a training experience is probably very unique, hopefully very positive and growth oriented. What would you say, maybe from your experience, what have you observed to be maybe a big shift or a breakthrough that an attendee might experience during or after one of these kind of intensive trainings?
Well, there are two, we have kind of two big tracks. The first one is our retreat, and
Mhm.
those are, 4-day group experiences where people do an individual IV session with a sitter, and then they do a, long kind of group, more ceremonial feel intranasal. And those 4 days build on each other. So we've got nature connection as part of that. We've got education as part of that, didactic group process, group sharing, the medicine sessions, integration, preparation with that, shared meals. So I think that is a very, very powerful learning container that really very quickly becomes, as much, if not more, of a personal retreat in which you learn professional skills. And I think that is very powerful. So that people get close to others in their cohort. They're excited to see them. They're often, delighted and very pleasantly surprised with how comfortable they feel with these new people. And they come out again, having had a personal experience and also having learned really important skills about working with the medicine. So it's a very experiential context. Um, the level one clinical intensive, that is very much about the nuts and bolts of doing CAP. So that's what people, really like the best about that. Again, it's taught by experienced providers and we're all doing the work. So, we're rolling through with like clinical cases and using those as examples. And again, the piece about gradually understanding all the different foundational pieces of working with ketamine, we have a video series. So the didactics are primarily done there. And then you learn all the different kind of core elements of doing ketamine assisted psychotherapy, most of which are applicable to other medicines as well, the different routes of administration. And then we move, more and more once we have the foundations into the how to's, like how to run a session, how to do
Mhm.
good preparation, how to do integration. And again, it's all highlighted by relevant clinical examples. And doing that, people are also doing their own work with the medicine. So they're really informing that. So what you can expect from that is that not only do you have your personal experience with the medicine, but you'll be really, really prepared to understand kind of the lay of the field, the lay of the land in the field, the how to's, practice building. It's designed as a direct pathway to practice. So, kind of all of the tools and skills and community and mentoring that you need in order to really effectively launch or deepen your practice in this area. And I think that is what people really love about the level one is you come out really ready to do the work. You're still going to benefit from mentoring and, having a community, but you have what you need to
Mhm.
effectively, either kind of start seeing clients or deepen into the work that you're already doing. So yeah.
Yeah, very nice. So, last question for you then. What do you kind of hope that participants walk away from these types of trainings with in terms of their understanding regarding ketamine assisted psychotherapy, its potential, maybe the responsibility of doing it?
Oh, yeah. So, so the piece is again about recognizing that you're doing your own work at the same time and how that
Mhm.
informs it, I think is really important. And, that's not just like what comes up for you on a personal level, but understanding the influence of, anybody else that you're interacting with, whether that be a sitter or even a clinic that you're in, and, using that to inform the way that you are engaging with the clients, I think is really important. So, as I just said, I think I really want people to actually feel, that they have a degree of competence, that they've
Mhm.
got some skills, and they really actually know what to do. I mean, certainly, there's nothing that can substitute for experience, but you know what to do. You know also what's likely to come up for you around that. And that you also have some tools for practice building, like how do you build a relationship with a prescriber, and or if you're a prescriber, how do you build a relationship with a therapist, and how are you going to grow your practice, and how are you going to run your business? Like, I'm not here to tell them how to do bookkeeping, but I've developed and redeveloped, my ketamine practice multiple times. I've had all of the other teaching faculty. So, some of those really practical, hands-on how-tos is what I really want people to know. And beyond that, like really a very in-depth appreciation. And I think that's where experience with the medicine also comes in, about how much people can change doing this work. I mean, this is really, really powerful, powerful work. And so, understanding that. And then, also I really want people to understand just about the potential adverse effects. So we had Dr. Roman Politsky on here, I don't know, a month ago or so, and he's actually running a big study about adverse effects through psychedelics. So understanding that people can and do have adverse impacts, people can be damaged by this work. And so how do we, change our approach to mitigate that? How can we understand when something that might be an adverse event can actually be transformed into a clinically relevant process? When do we push clients? When do we not? Like, how do we work with that? And do we have an understanding of the fact that this can happen? It's not just all like, oh, the medicine does the work, and if bad things happen, well, that's just what it's supposed to be. No, like that is our responsibility as therapists, as clinicians, as facilitators, to do our very, very best to help produce a positive outcome for a client. And positive outcome does not always mean happy, happy, joy, joy. It means something that is relevant and meaningful and learning and not damaging. Of course, the do no harm. And, again, just this right use of power piece is so important. Like, we have to really be mindful about in our field about we have so much power over a client. They put so much trust in us. And then also us in community with each other. This is weird and wild and interesting and fascinating work. And we learn profound and interesting things. And we need to really hold each other accountable to avoid guruism, to avoid any type of getting on any sort of elevated kind of piece, because we're all in this together. So really understanding that, by supporting each other, we can grow together. And that's ultimately, what the village is all about. So the importance of a village, I think, is also really important. So that's a great question. Thank you.
Okay. Yeah. Yeah. Good stuff. Well, hey, it's always great talking to you, Dr. Sandy. This conversation makes me kind of wish I was a therapist. It sounds very exciting. But yeah, always good to talk to you. And yeah, thanks for sharing your knowledge and your insights on these trainings.
All right. Thank you, Chad. I really appreciate you, and I appreciate your time. Thanks so much.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.